Welcome to RSSDI TV 2020. I am Dr. Ruchi Shah, and on behalf of Wockhardt RSSDI 2020, I welcome you all. I am glad to have with us today a renowned endocrinologist from Delhi, Dr. Naval Vikram sir. Sir is a professor, Department of Medicine, AIIMS, New Delhi. Sir has a rich clinical experience in managing diabetes patients. Welcome Dr. Naval Vikram sir to the show.
Thank you.
So, sir, based on your recent talk in RSSDI 2020 on a very interesting topic of tight glycemic control, is it really beneficial? We would like to know from you, what is the tight glycemic control?
Tight glycemic control is defined as achieving HbA1c levels less than 7 or even 6.5, which is considered to be the normal hemoglobin A1c. So anything to achieve below 6.5 would be termed as a tight glycemic control.
Okay, thank you so much. So, sir, the next question is tight glycemic control beneficial for each and every patient with diabetes?
You see, tight glycemic control is useful, but it may not be good for everybody. The strategy or the level of glycemic control that we want to achieve should be individualized. Tight glycemic control is useful, especially for patients with type 1 diabetes, younger individuals who have a relatively long life expectancy. So the longer they are having less glycemic control or impaired glycemic control, the longer they will be exposed to high glucose, and they will have more chances of developing complications later in the life. So in these individuals, a tight glycemic control is good and should be aimed at, and also in diabetes in pregnancy, because in utero, the fetus, if is exposed to high levels of blood glucose, then the chances of having complications, maternal and fetal, both are increased. So pregnancy, diabetes in pregnancy, a very tight glycemic control should be achieved. But it may not be useful for elderly or with multiple comorbidities whose life expectancy is not too much.
So, the last question, what are the problems associated with tight glycemic control and how to overcome them?
So tight glycemic control has been studied extensively, and it can prevent microvascular and macrovascular complications. That is right. But along the flip side of that is it exposes the individual to a increased risk of developing hypoglycemia. This may be particularly dangerous in individuals who have other comorbidities like coronary artery disease, heart failure, and elderly individuals. So there, even if such a person has like blood glucose slightly in the higher range, say HbA1c is somewhere between 7 to 8, that will not going to harm such an individual in the short run or in the acute situation. However, a single episode of hypoglycemia can be fatal. A patient with coronary artery disease or a heart problem can have an acute coronary event. An elderly having an episode of hypoglycemia can have fall and sustain a fracture of hip. So that will be a comorbidity which will increase the complication, and that can also lead to death. So hypoglycemia, even a single episode in elderly, can be fatal, potentially fatal, I would say. So that is one major risk of achieving tight glycemic control, and that is why the glycemic control strategy I would emphasize, should be individualized depending on the age, the presence of comorbidities, and the life expectancy.
Thank you. Thank you so much, sir, for sharing your views on this topic of tight glycemic control. And stay tuned to RSSDI TV 2020, brought to you by Wockhardt, for more recent updates from RSSDI 2020. Thank you very much.
Thank you.